We had Jamie Hall here last year sharing the launch of their psychological health and safety strategy for the province, and Geoffrey's involved in that. And then part of that has been to create hazard training for psychosocial hazards, which he's going to share with us.
Good morning, everybody. My name's Geoffrey Thompson. I'm an occupational health nurse from it is MFL, Manitoba Federation of Labor Occupational Health Center, which is a bit of a mouthful. So we just go by the OHC. And we're small. We're 10 employees. I was joking with Val earlier. I'm actually the only full-time clinical person there. We have 2 physicians. They each share a full-time position. And we have another nurse. She's a 0.7, a couple social workers, a couple admin staff. And we have a provincial mandate. So we're, Manitoba's nowhere near as large as Ontario, but it's hard to sometimes get out of Winnipeg. There's a joke that they call it perimeter-itis, where folks in the north feel like so much attention is based around Winnipeg or the rural areas around Winnipeg. It can be a challenge to feel relevant for some of those folks. We're funded by the Winnipeg Regional Health Authority, which is also confusing because here we have a provincial mandate and yet we're paid for by more Winnipeg tax dollars, theoretically. But at any rate, I don't do a lot of client care. I mostly do health promotion and outreach education. So I do a lot of adult education. And my background actually, besides nursing, is public health, community development. I kind of fell into occupational health and safety quite by accident. I'm from the States originally, so I have to kind of get that out there. Well, I don't have to, but I'm quite grateful to be a happy resident of Canada, for sure. And what I love about the work I do actually is taking a community health, community development lens to my work and looking at workplaces as communities. And I'm the implementer. I'm married to a researcher, so I totally appreciate John's presentation. But now we're going to talk about implementation, which is where the rubber hits the road. And I like this slide because it kind of grounds, at least for me, the values around where work happens, right? I mean, we spend, 60% of our lives at work if you're fortunate to be gainfully employed. And so all of these factors really do contribute to whether, life at home is going to be productive and healthy, and then, of course, your wider community. So I think when we're especially talking about mental health in the workplace, just understanding that what we do at work doesn't stay at work. I'm a believer that actually the work-life balance is a bit of a myth, that you can't just be turned off from your normal life the minute you get to work. And so we do some other programming around building compassion into workplaces. It's kind of another organizational approach. There's some psychology around that's been cooking for the last 10 or 15 years. But here today, of course, we're talking about the work that we're doing around the CSA standard. So we are one of 2 or 3 other organizations in Manitoba who are involved in helping Safe Work Manitoba, the prevention arm of Workers' Compensation Bureau, to deliver or at least promote this standard in workplaces. And we've been involved with that strategy that Val mentioned since 2016. I've been in the job at OHC since 2015. So they basically funneled me right into this. So this is mostly what I've been doing for the last almost 4 years. And it's been really interesting. We've OHC sat on the advisory committee at Safe Work with CMHA, their local office there in Winnipeg, to help develop the standard. And of course, we have another relationship with the Mental Health Commission of Canada, but they haven't been as involved, and it makes sense with the implementation side. This has been very much a local effort. And so this is our strategy. We ran out of copies. It is available online if you're interested. You can just visit the Safe Work Manitoba website. And out of that strategy, I just have the one slide here that highlights really what the purpose of it was. And I like that they really centered on community, partnering with communities, and understanding that a lot of the expertise in delivering this was outside of government, right? And we kind of treat Safe Work like government because, that's how they're funded. and they have kind of more of a corporate mindset, which I get. They have a lot of sometimes competing interests in how they deliver their programs. But those of us in the nonprofit and community health sector, we're kind of like a bit more practical in some of it. So you'll probably hear a bit of that. There's nobody here from Safe Work, right? No, it's fine. I know this is going on video. No, they're wonderful partners, and this really did help us frame out what we're doing using an OHS framework, raising awareness, and then really building capacity. So this program, one of the big things that the strategy talked about was, of course, education and outreach. And so it was a bit, I don't want to say painful, definitely a challenging process to get so many people at the table to develop this kind of a course. The idea is to normalize the idea of psychosocial or psychological hazards as a hazard, or forms of hazards. And so we're using kind of that safe work model of spot the hazard, assess the risk, implement, control, and then reevaluate, that whole cycle, right? So we're trying to make it kind of like a lower bar, an easier lift to just kind of tap into your existing systems and add a psychological health and safety lens. So this is just basically the agenda. It's a one-day course, free. I'll talk a little bit more about the curriculum development. This is how we cover our material it's a lot. I'll tell you right now, our margins are thin to try and get through all this material in one day. We have some really interesting activities where we have participants actually work out their own kind of case. The moral case, the business case, the legal case. Rather than us lecturing to them, we give them lots of time with flip charts and material in our manual, which incidentally, we created a manual, 68 pages. It's funny, when we started, we're like, oh, we'll do 25 pages. It's like, oh no. So I have a couple copies up there. I'm not in a position to just hand this out like candy right now. Our contract ends end of October. Although I have business cards up there, so if you're really interested in more material about the course, email me, and I'm sure we can make arrangements to share materials. Because the idea is to not brand this. Safe Work isn't branding it, and it's up to us in the community to make it available and to spread the word. So we have 12 sessions slated for the year, and so far we've done 5, so we're almost halfway. But it's intended to be very practical, addressing concerns, and we spend the afternoon looking, kind of revisiting the key components of a health and safety system. What does that look like? I think it's probably pretty similar to Ontario. I think a lot of the provinces are on the same page with this. But the key idea is how to get started. That's the hardest part for folks, right? So besides going through certainly a piece around mental health awareness, priority concerns like violence and harassment prevention, the legal requirements, right? And if folks are in really kind of a toxic situation, we say, let's start there. If you're a construction site with, some language or respect issues, maybe having some more talk around codes of conduct and things of that nature might be where you start. So helping organizations understand where they're at rather than feeling like they have to adopt the entire standard, because I think when they read that, it's a bit intimidating. And of course, we spend considerable time just discussing these 13 factors plus the 14th, thank you. We do include that. And we do kind of like democracy exercises where people kind of rate themselves in their organization. It's interesting because it's open to the general public and hosted by the industry-based safety associations. So when I say lots of cooks in the kitchen, it gets a little bit crowded sometimes. They host the sessions, but anyone can sign up for them. And you get interesting groups of people at tables talking about the very things you were talking about, John, kind of some of the challenges between sectors and some of the inconsistencies, but then some of the similarities, right? We're all human. We're all like in this together, and mental health is something we all share. So it's been an interesting kind of journey to see people's eyes kind of open, be like, I didn't know that education and construction might actually have some things in common, right? So yeah, like I said already, this is, I kind of nicknamed this the Blue Tangerine. They invented this logo or this graphic for the course. In Manitoba, the legislation calls for 11 elements. Some of the safety associations actually have up to 13. And so we, in the course, cover 4 or 5 of those, but we don't get through all 11. We learned that in the pilot too much. So, but it's all in here. We have all 11 in here. So we tell folks to take the manual as a resource, go back to your workplaces, and talk about some of the other ideas. So I think I'm probably preaching to the choir here. I will spend only like 30 seconds on this. But we focus a whole lot on this, right? This middle area along the pathway. As much as we'd love to focus on, perhaps people problems at the very top of this inverted pyramid, we're really trying to get people out. Stop thinking about worker level, even training happening here, mental health first aid, resiliency training. That stuff's great, but let's get a little bit further upstream here and talk about some of those systems that could be looked into. And it's funny, I've been doing this for so long now, I keep thinking, well, isn't this obvious? But for folks, this is like, well, whoa, this is really new ways of thinking around that mental health happens here, like prevention happens at that pathway level. And I get credit for this one, but I just call it the 3 C's. Commitment, committee, communications. I mean, it's kind of silly, but it's really that first section of the CSA standard where you got to build that foundation. And this is really that getting started part. If you can get that leadership statement, get a working group together, whether it's your health and safety committee or a souped up wellness committee, just something, getting some leadership on that. And then, of course, having a plan around communications and messaging. I tell people that just bringing this out in the open and talking about it as an issue is already working on how many of these? 13, right? Involvement and influence is a huge one. Just the fact that leaders in an organization would even talk about mental health or psychological health and safety does a lot to trickle over and improve any one of those. So that's why it's overwhelming sometimes to see all 13, and you're like, gosh, how can we do this? But if you just focus on 1 or 2, you can go pretty far. So quickly, we started this in September last year. The RFP came through. It was kind of one of those written more for our organizations, but they had to publicly release it. So CMHA and OHC were the 2 partner organizations. We developed it. We had a pilot in December. Realized too much, so we scaled it back, trimmed it down, launched it in March. And like I said, we're doing 12 sessions this year, and it ends in October. And they're filling up fast. Not that I say you need to get on a flight to Winnipeg or anything like that, but locally, people are interested in this. And we're at this workshop development or delivery phase. So this part was really important. It's never been done like this before at Safe Work Manitoba, where they've outsourced the development to the community, and then the IBSPs are like the hosts. So they're the venue. And so they're the ones who formulate. First of all, they had to convince the community of safety practitioners that this kind of training had value. And then we had to invite them to the pilot and continually cultivate that. So Safe Work did a lot of that work. The registration portal was on their website, but then every safety association handled each registration. So there was a lot of autonomy in this, and I think that's where people really appreciated that. And then for us, myself and the co-facilitator from CMHA, we would call and coordinate with the venue. So, like I said, 5 sessions, not a lot of participants yet, 84, but each one's getting more and more. I think the average was 17, now we're up to 22, 25. I think we've capped it at 25 because it just gets too big. There's been a real interest. And trucking, manufacturing, and motor vehicle associations have been the first. Construction's been a little bit harder to get on board, but they're coming through. And yeah. The real challenge now is what do we do with all the follow-up requests? And I'll spend a little bit of time on that when it comes to lessons learned. I mean, I've only got 3 slides left. We doing all right? 10 minutes? Okay. Yeah, this is hard. I recommend it, though. I think it's important. I think you're going to get a better quality product when you do this kind of thing. but it's not easy. And I've learned when you go through 18 versions of a lesson plan, not to take anything too personally. Just let it go. Let it go. Don't feel like you own anything. I don't know, how many educators are in the room? How many actually do adult education, curriculum development? Yeah. So I think I feel you. This can be real hard. And then you have this political layer too, right? And so it's really like Safe Work Manitoba, 2 community nonprofit agencies that are used to being like bootstrapped and just, we can do this. And you're used to running on slim margins, whereas government's like, got to do this, and this. And then you have a somewhat incredulous community of safety professionals who are like, what is this thing? And so it was a lot of relationship building and understanding what their needs are. I did a session for manufacturing, and they felt like, the harassment part, some of the training available provincially just wasn't really, there wasn't really any specificity to their particular needs, which is totally understandable. So I took that feedback back to Safe Work, and I said, maybe we should develop some other training specific for them. The only challenge with this hazard as a hazard course is it's, at least initially, kind of more general. Like that research is really helpful because it kind of helps us figure out maybe which sectors to focus on first. Safe Work's mandate, of course, is all workplaces, and same with us, we're all workplaces. And so I think down the road, as we develop more relationships, we can kind of fine-tune some of this content. For us, because we're worker-focused, just like iCal, it's a bit challenging to think, getting quote-unquote in bed with employer-based safety associations. Like, this is kind of new for us. And we usually go where there's fewer resources to begin with, either other nonprofits or other, I heard migrant workers. We do work with newcomers and such. So that's where a lot of our heart and soul goes. And so now to be at this higher level working with employer-based associations can be a real challenge. Like, to us, at least to me, thinking I'm like, they've got a lot of money, but we have other expertise that I think brings kind of another perspective to the table, which I think employers need to hear. And understanding our capacity. Like I said, we're small, not saying yes to everything. I would say curriculum tweaks involve a whole lot more discussion around stigma and stereotype. That's a huge one. A little bit less on some of the dry material around health and safety language, because you're getting a whole variety of folks in the room. Most of them are committee members, health and safety committee members. But oh my goodness, this brings out a whole lot of, when you do stigma-based scenarios and case studies, really interesting, can get a bit dicey, but really, really important, because that's what's going to get people talking about this issue, is that it's underground, we need to deal with it. And then, managing the interest in the follow-up, and I'll talk about that in a minute. Right, so the fact that they're opening this up as free-for-all, literally starting October 31st, you can download the manual and have all you want. But at least provincially, we want to stay ahead of it. CMHA is probably going to take the lead, and we'll come on board, I think, as more of an advisory member, focusing on committees. Oh, this is awesome. This actually is great, because we have a hard time sometimes getting into non-unionized environments. So this is bringing more attention to that. And I'm getting phone calls from people who haven't heard of us, for one, but then also are just blown away by the fact that this kind of material is out there. Ideally, and this is something the Mental Health Commission's really gung-ho on, is building communities of practice around this. And so if you can get people within a sector who are implementing the CSA standard on some level, how you could help each other out. So that's basically what a community of practice does. Like I said, CMHA will probably take the lead after October. They have over 100 employees, and we're 10, so they're 10 times bigger than us. So we can't do everything, but we want to be sure that our perspective is definitely included. And so we're just looking at whether we do a master trainer versus a peer-to-peer train-the-trainer. For the IBSPs, they might go more a peer-driven model, but then we could maybe help modulate that a little bit, because quality is really important. And I think what's really unique about this program is it brings a mental health expert, I didn't clarify this, a mental health expert from CMHA with an occupational health and safety expert, which I guess is me, and we do a whole day session together. And so whereas co-facilitation is resource intensive and we had to have backups, so that's basically 4 people trained up to deliver this on a moment's notice, is a lot, especially for our small shop. But that's it. I didn't talk as much about too many specifics. You can read the manual. I'll have a couple copies in the back. Just don't take them. But like I said, if you are interested in any of this material, let me know. Email me, or I'm going to give Val, we'll get what I have left here, and you can play nice with her. Maybe she'll hand them over. Any questions on this? You'll put them in the library? Good. Yes?
In Ontario, we are very interested in measuring the impact of
Yes.
initiatives like this. What are you
Didn't
doing
talk
in
much about that.
Manitoba?
Good question. How do you measure the impact of adult education? Does anyone have the answer to that? It's kind of like that holy grail question. Yeah, it's challenging. You're right. I like to measure impact in terms of relationships. I'm actually interested. I built a database at my work, and I like network analysis. I mean, I'm not an expert in this, but I like to look at the services we do and actually see, how many repeat services do we get? How many times do the same people keep coming back, right? Rather than necessarily testing people's knowledge all the time, which is really challenging. I think surveys have their place for sure. But for a small agency like us, I guess the impact would be, is the word getting out? How many other phone calls am I getting? It's kind of a proxy with regard to measuring impact. I think you've hit it right on. We do evaluations as far as the usual paper evaluations, and we score 3.6 out of 4 on a 4-point scale, so yay, we're doing good. But I mean, in terms of overall impact, it's a real challenge. But yeah, I think it's partnerships and relationships are kind of what I'm focused on at the moment, rather than knowledge checking. But it should all be in there, but it's hard. I know that really wasn't a very nice answer, so.
I have another question.
Yeah.
Well, just I guess, are you, so this is a training module
Yes.
that's then going to be freely available for people who have an interest and the capacity to be able to deliver. Are there any tools and resources that are going to be developed to go along with it for workplaces to implement some of, they go through the training, they
Yeah,
go and
yeah.
do, or is it meant to be treat it like a hazard and use all your health and safety tools?
Yeah, it's a bit of both. I mean, on the one hand, there's that double standard of physical hazards versus psychological hazards, and how all this attention is put onto physical or environmental versus the mental. So it's easy to say on paper or in a course, just take your same physical hazard system and adapt it to be psychologically safe. That's challenging. I mean, I think we're selling it along those lines, and so we're telling folks, use the materials you have, go to the Assembling the Pieces implementation guide for the CSA standard. A lot of the resources are in here. But I think some of the early feedback we're getting is each sector, it's natural to think we're the center of the world, our world of industry or economics, and we would like material that's specific to us. So I think that might be the next phase. But otherwise, we're just routing people to a lot of the supportive material for this, implementing the CSA standard and using existing legislation and practices. Because this is a very general course. This is just putting our toe in the water. And then I'm hoping out of that we get some more specific kind of uptake and requests for more. So I'm here I don't want to say all day, I guess till 1 or 2 or whatever. So if you have questions, come talk to me. My card's in the back or the front. And thumb through this and let me know if you're interested in having, because we don't want to make it impossible to get, right? So I'm putting a little feather out there saying, you can probably get this, but just reach out to me directly. Okay, thank you.